Okay, so today we brought in our specialist, Darren from Embrace, to talk to you about the absolute best scar care you can do post-procedure to get the best results possible. What's different about Embrace is it uses not only silicone gel sheeting, it's done under tension, which pulls your tissue back together again and takes pressure off your healing incisions for the best scar possible. Now, this is a great product to use for people who do not have allergies to adhesive. So if you have tape allergies, don't even try, because this might cause an allergic reaction to your skin. But for those patients who are having an abdominoplasty, brachioplasty, or arm lift, inner thigh lift, and breast surgery, this can be a great form of scar care to get you the best result possible. So you want to start at maybe about 2 weeks, or whenever your incision is intact with no scabbing on it and it's nice and clean. So we recommend cleaning the area off. I'll let you do it. Cleaning the area off with first alcohol and then a skin prep from Cavalon, and we can get that for you here. So you want the oils off your skin so that this sticks really well. This is a really, as he's cleaning off my skin, this is a very cool technology where they used to have specialists in Palo Alto making these by hand, and it was a very expensive technology, but they figured out a way to do this cheaper, and we're passing that savings on to you guys so that you can use this through the full 8 weeks that it's recommended without it making a big impact on your pocketbook. So while it is the most expensive scar care that we offer, it is hands down the most aggressive and best scar care that you can do. So Darren's going to show you how to open this. It comes out of the package, and you want to open it fairly quickly and bend it back on itself. So this sheet right here is the silicone with some adhesive on it. And these little lines or perforations there allow you to flex and bend this so that you can actually get a little bit more pressure as it comes on. So pretend like I had an incision right here on my arm. See how this line, you're going to line that up with the scar that you have. So that just acts as a little bit of a guide. He's pressing it down against my skin, and you really want to push and hold and apply pressure for about 30 seconds. That really gets things to stick down well, and the warmth actually helps it to adhere. Here comes the fancy part, these tabs on the side. You pull them away in the direction of the arrow. You know, I kind of feel like a flight attendant telling people there are two things. So then after you peel those off, you want to push down again. You can use your thumbnail, you can use your palm of your hand. You just want to get a lot of nice adherence, and then you peel this away, and there it is right on my skin. This can stay on for about 10 days. If there is a lot of fluid accumulating underneath it, that means we were probably a little early and you might want to take it off. There are some hints about putting this on. So if you're going to do your abdominoplasty incision, it's best to do it standing and apply it in a mirror or laying down flat. So you don't want to be hunched over when you put that on. If you're doing a brachioplasty incision here, think about putting your hand right behind your head and applying it like this. If it's an inner thigh lift where the seam of your pants is here, you may just want to cross your leg and apply it just like this. So other areas, if you had a body lift and went around the back, you might have to have somebody help you put that one on. That one would be pretty difficult. Now, taking this off also has its own tricks, because if you peel it off, it is so well adherent on there, and again, it should last for at least 10 days. When you take it off, you can actually pull your skin off too much. So taking it off is an art as well. And what you want to do is start in one corner, gently lift, and use soap and water. Underneath it, maybe baby oil or an adhesive remover. And then you want to leave it off for 12 to 24 hours to let your skin breathe. There are some tricks in doing, if you have an incision underneath your breast from a breast reduction or a breast lift, you want to pull up on your breast and apply it, and you want there to be more on the bottom of your breast than on your chest wall. So you wouldn't line that one exactly over the incision, but go just a little bit higher, okay? Embrace also comes in different sizes, Our extra large is going to be great for the abdominoplasty, arms, and thighs. Also maybe for the inframammary incision if you have a full anchor breast reduction scar. This is a little bit smaller size, which is great for areas like the lollipop mastopexy, where when you put that one on, you actually will cover the whole nipple and areola to get that covered. These boxes also show on the bottom a little before and after of one side that was treated with traditional scar care and another one with the Embrace. And they've gone kind of head to head with most of the scar care that we offer here, and it really is superior in these surgical sites if you can use Embrace. Why don't you run over stuff just really quickly again about the pointers that people need to remember about when to start using it, some little tricks of the trade, and how to take it off safely.
Sure. So Embrace is first applied as soon as your incision is closed and dry. So that means that your scabbing is gone, there's no oozing at all. Usually this occurs about 2 to 3 weeks post-op, and that's the best point to start actually applying Embrace. Once you are ready to apply, we'll prep the area with alcohol first to make sure we remove any excess oil, and then we'll apply the dressing. It'll stay on for 10 days, and then after 10 days, you'll gently remove it, either with soap and water, baby oil, or adhesive remover, and then let it breathe for 12 to 24 hours. And then we'll reapply again, and this is for a total of 8 weeks. 8 weeks is the clinical recommendation to achieve the best outcome in terms of your scar.
So if you have a typical abdominoplasty, that might mean about 5 boxes of this extra large size.
Yep, for a tummy tuck, you'd use on average about five large boxes.
And if you are a full breast reduction with a full incision on the bottom and one here, that's going to be about 7 boxes.
7 boxes is
okay.
Correct, yeah.
And then inner thighs probably about 7 boxes.
Correct.
Arms again about maybe 5. 4 to 5?
4 for that.
Okay.
Yeah.
So probably ideally, it's good to pick up once you get started on it and you're sure you like it, it's probably good to take with you the amount that they recommend for the 8 weeks so you don't find yourself slacking off and you're not as compliant. It is nice to know that you're compliant for at least the 10 days that it's on, and it makes it easy to have one day that you reapply it and then you're good for another 10 days.
Yep.